During the National HIV and AIDS Symposium that was held at the Office of the Presidency Conference Hall under the theme Accelerating Interventions to End AIDS by 2030, with the main objective of sharing achievements made as a country towards AIDS control and 2030 goals of ending AIDS in Uganda, Health Minister Honorable Dr. Ruth Acheng revealed that HIV/AIDS has continued to affect the economy of the country because the country spends a lot of money annually on HIV/AIDS patients, calling upon the stakeholders to incur efforts in ending the epidemic by 2030.
Is that as a country we don't have a choice. We must end AIDS by 2030. HIV alone has locked the economy. We spend annually $540 million annually. It is almost equal to the amount of money, actually much more than the amount of money that we are currently injecting into PDM. Because PDM is 1.2 trillion, this is about 1.9. Now, if we spend that money annually, I want you to listen to this. Currently, we have about 1.4 million people on antiretroviral drugs. The older ones will die away. The new cases are coming in. So you keep that money locked for generations.
Minister Cheng highlighted that the high rate of HIV infection in Uganda poses a significant challenge to the country's efforts to overcome poverty. She emphasized the importance of sensitizing youth, women and men, as well as ensuring that no child is born with HIV.
As long as we still have a high rate of infection, Uganda will remain in poverty. So our duty, me and you, is to talk to the youth, is to talk to the women, talk to the men, ensure that no baby is born with HIV.
Minister Acheng added that while the new HIV infections have decreased annually, the numbers remain high, indicating that continued efforts are necessary to further reduce the infection rate.
Through concerted efforts with our partners, we have reduced new HIV infections from 41,800 now to 38,200 in the last financial year. Imagine getting 38,200 new infections every year. Where we have come from was high. This is not good. We shouldn't even be talking about thousands. If we were talking about getting 5 new cases every year, that would be nice.
In his opening remarks, Julius Kakande, Secretary of the Office of the President, called on the community of people living with HIV, as well as the general public, to emulate those who have made significant contributions in the fight to end HIV/AIDS in Uganda.
Community of people living with HIV and the public at large to emulate such heroes like Dr. Stephen Watiti, Gideon Yamsha, I think he's here, and the rest who have emulated the late Bongoley Lutaaya and are publicly and positively living with HIV to bring an end to HIV-related stigma and discrimination.
The annual Joint AIDS Report 2023-2024 indicates that despite the continuous decline of HIV prevalence continues to be higher among women compared to men.
Note that this has continued to decline, although the prevalence is still higher among women compared to men. Prevalence is 6.5% among women 15 to 49 years and 3.6% amongst men.
Dr. Vincent Bagambe, Director of Planning and Strategic Information at Uganda AIDS Commission, stated that over the past 4 years of implementing the National Strategic Plan, the country has made significant progress in the fight against HIV/AIDS and is reducing its prevalence.
In the 4 years of implementing the National Strategic Plan, new HIV infections we've been able to dent new HIV infections, reducing them from 54,000 registered in 2020 to now 38,000 registered in 2023.
According to the HIV AIDS Fact Sheet 2023, districts with high HIV prevalence among individuals aged 15 to 49 years include Fort Portal City with a prevalence rate of 14.1%, Kabarore at 11.6%, Bushenyi at 9.1%, Mbarara City at 11.1%, Masaka City at 11.3%, Boyukwe at 9.1%, Bukoma Simbi at 9.1%, among others. Julius Muhumuza, Church of Uganda Family TV, News at 8.